My name is Cameron Zimmer. I'm one of the owners of Mady Mills Physical Therapy. We've been around for 30 years, actually, or a little bit more. We have offices. We have an office right down York Road in Lutherville, and we also have one in Overley, which is where I work. So tonight we're going to discuss a little bit about some of the common injuries to the lumbar spine that can be associated with prolonged sitting, lifting, and good old-fashioned truck driving. Now, also, we'll try to talk about some modifications that you guys might be able to utilize to be able to avoid lower back injuries, and maybe a few exercises that you guys could work into your daily life to help with that as well. So, here we have our lovely lumbar spine. And so, actually it's the whole spine. So the lumbar spine is the lower 5 vertebrae, L1 through L5. Now, you name the levels of the lumbar spine based upon the spaces between them. So you have L5, S1, L4, 5, that sort of thing. I'm sure you guys have all heard people talk about having back pain and, oh, you know, L5, S1, and they'll say the doctor says something's wrong with L5, S1. So L4, 5 and L5, S1 are the two most common areas that people are going to have injuries. You don't hear too many people talking about L1, 2, although you can have injuries associated with that. So, in the lumbar spine, you have your vertebrae, and then you have your discs in between. And then on the side, you can see that there are these little rubbery things coming out. These are supposed to represent the nerves that come out of the lumbar spine. So, when everything is working well, there's a nice space for the nerve to be. But sometimes when you get degeneration of the discs, which are right here, they can get much, much smaller. And so then the space between the vertebrae gets a lot smaller. Also, there are these little joints, which are called the facet joints. And so those joints can develop arthritis over time because of good old-fashioned wear and tear. And so again, that arthritis can take up the space where the nerves are. So when you run out of space for the nerves, then you can have what people often call a pinched nerve, where you're having back pain often and then pain shooting down the leg, or sciatica. People often call it sciatica. So, how do we fix that? How do we limit that potential for those problems? So, the first thing we want to talk about is lifting. So, lifting, you guys are doing probably quite a bit of lifting. As I didn't know, I treat a lot of guys who drive trucks, and I just thought, well, guys who drive trucks drive trucks. I didn't realize that you actually oftentimes have to load and unload what you're driving around. So that was new to me about 15 years ago. So when you are lifting, you want to avoid certain things. The most important thing is that you want to avoid bending at the waist. Now, as we talked about earlier, everybody knows that. Everybody will tell you that they know, yes, I'm not supposed to bend from the waist, I'm supposed to bend from the knees, but no one actually does it because you don't think about it. You spent your whole life just doing things, not thinking about it. So you just pick it up and then you keep on going. But over time, that's going to cause problems. It's not bending over and picking something up once, it's bending over and picking something up 100 times, 1,000 times. And then age gets thrown in there too, and that's also a factor. So we want to try to avoid the bending factor at the waist. You don't want to lean from the shoulders, you want to squat down nicely and pick something up. Now, the other big thing about lifting is that when you lift, you just want to lift. You don't want to bend and twist at the same time. So you want to bend over and pick it up. You don't want to bend over, pick it up, and put it in something, like if you were, lifting a bag of mulch or something, you pick it up and you throw it in your wheelbarrow. You don't want to do that. So you want to pick up, move, and put your load down. The problem is that takes more time, and people aren't interested in taking more time to do something. They want to do it as quickly as possible. But trust me, if you herniate a disc, it's going to take way more time. So what do you do? What are the things we want to do? If you find that you're having a load that is heavy, maybe there's somebody else around to help you. It depends. Everybody knows their tolerance for lifting. Some people can lift a lot. Other people, you might have some injuries in the past. Maybe you don't want to lift as much. If there's a friend around to help you, great. If you have equipment that can help you, that would be great too. Again, that takes a little bit more time to do, but try to focus on those things. Another thing, if you find that you're lifting material often, like let's say, you have a warehouse full of whatever, and you're always lifting the same thing over and over again. If it's something that's really heavy, trying to put it in a place that is more convenient can be helpful. So if I'm lifting something that's on a shelf this height, it's going to be a lot easier for me to lift it up versus having to go all the way down from the ground to lift it up. So then, as we talked about, when you're lifting, you want to bend from the knees. So you want to actually let your hips and your core do the work versus your back doing the work. So you want to tighten everything before you come down. You want to keep the load close to you as you come up and keep everything tight. Now that's, I said close to you. No one does this, but it's really important to think about that. If you hold something out here, it's going to be a lot heavier than keeping it close to you. So let's say you were trying to put something on a shelf. You don't want to stand here and fling it out there. You want to go close, put the load down. So now as far as lifting, you have a couple of different options. I prefer the squatting technique, but some people have bad knees and they say, well, I can't squat. And so then I recommend kind of doing a half kneeling position and then coming up. But I don't think that's as stable, personally. I don't feel as strong when I do that, so I prefer the squatting. Now also, I put on your little handout, the golfer's lift for lighter items. This does not work for a heavy box, but it can work if you drop something like your pen on the floor. You have something close to you, you can hold on to it, come over like this. I'll do it to the side, but bring a leg out, come up, pick it up. I can't tell you how many people I have seen over the years that have herniated discs picking up like a gym sock off the floor, just because they bent over that one last time and picked it up. So now, any questions about lifting technique? Anything you guys want to know? No. Okay. All right, so now, as I may have mentioned, people who drive trucks are at a significantly higher risk for back pain than the national average. The reason for that is because, one, you're sitting a lot. Two, the vibration from the truck itself is actually causing issues. And three, the rough roads. We don't have the greatest roads around here, so they cause some issues. So now, the reason for that is that the constant vibration is actually increasing the speed at which we're losing fluid from our discs. So the fluid comes out of the discs, they get smaller, we run into problems. So trucks are much better these days than they were before. So a lot of trucks are going to have the newest technology, they're going to have the lumbar support, they're going to have the better springs in the seats. But you're still sitting, you're still doing that same job, and you're doing it for hours at a time. So how do we address that? So the number one thing is, I think, lumbar support. So this is the lumbar support that I use. This is called a lumbar roll. But there are probably, I couldn't even tell you how many options there are for lumbar support. You could probably look at Amazon and find at least 100 different options out there that you could buy for a reasonable price if your truck doesn't have the proper lumbar support. So with lumbar support, what it is supposed to do is put your back in a better position when you are sitting. So if I am sitting, and I'll try to do a little bit of a side view so you guys can see and I can still look at you. So when you sit, your back is flexed. It's just the natural mechanics of your spine. You can't get away from it. But if you sit with something behind you, and this chair is not the best because the back is not going to really allow for me to put it in the right spot, but you want to put your lumbar support right around belt height, and then I'll put it up a little higher because I can't in this chair. And you're just going to gently lean back over it. So you're allowing your body to extend backwards. It's going to feel like you're sticking your chest out a little bit, but you get used to it. And so again, putting you in a better, more desirable position. Now, If you don't have lumbar support, you don't feel like buying something, you could use something around the house. Some people just use a pillow, literally a bed pillow. You can put it back there. Some people I've even seen, they put their pillow there and they put a belt around them. It keeps the pillow in the right spot, especially if you're doing long truck drives, it can be helpful. Also, I suggest rolling up maybe a beach towel or a small blanket and putting it there, and you can kind of mimic a position like this, put it right there, and it goes anywhere with you. You can put it in your personal car, you can put it in your truck, you can do whatever with. So that's the most important thing. But then, as everyone liked this suggestion, you have to take breaks. Now some of you, I don't know how long your rides are. I've met truck drivers that drive across country, and I've met truck drivers that drive down the street. So some of you will have those breaks built into your day, but others may be driving a little bit more regularly. So it would be nice if you could try to get out of the truck maybe every hour or so. But you know, it can't always work out that way, but it is nice. It's a good goal anyway. And then after a long drive, this is one that I bet you're all guilty of. You just get out and you just jump out of the truck. And that's, you know, when you've been in the truck for a while, your spine is at its most compressed position. And it's at its most risk for injury at that point. So what you want to do, you want to get out a little more gently from the truck, come down, and then maybe consider doing a little bit of stretching right when you get out. It won't take but a few minutes to do, even a few seconds to do, better than nothing. So at this point I suggest two particular stretches, and we'll go on to some of the stretching more in a minute, but you know, one, you put your hands on the back of your back and you just gently lean backwards. Nice and gentle. You don't want to cause pain. This should never cause pain. A little stretching is fine, never pain. Certainly no pain going into the legs. That's bad. And then the other one that people find useful is to kind of literally hang on to the truck. You can hang on to the bumper or whatever and just come down. Your hands will be up here, of course. But you're going to come down and squat, and that'll give you a little bit of a stretch to the back. So you can do a couple of those, loosen up, and then go on, unload wherever you have to unload or get back into the truck, whatever it is that you are doing. All right. Any questions about that? No? Okay. All right, so any of you actually sit at a desk all day? Okay, yeah. All right. So we do have a few of you. So sitting at a desk is, I think, one of the worst things that people can do for their bodies, because you end up sitting at a desk for hours and hours at a time, and it's not good for you. For the same reasons that we talked about driving the truck, that your back is flexed for a long period of time. So what you want to do is you want to, again, utilize the same exact lumbar support that I was just talking about before. And this is something, you get some lumbar support that you can put in the car with you, drive to work, depending on how long your commute is, and then you bring it with you into work, you put it in your chair, you hang out, then you go home. Now, what you can do is make some adjustments to your chair, and hopefully you guys have already done some of this assessment to your desks and whatnot. But first you want to adjust the chair. And I'll move the chair over there, but we're not going to go for that. So you want to first adjust the seat height. There's a picture in your handout that actually has, it's the next page after the seating, which has a little diagram for you that is easy reference. But so you want to make sure that your seat height allows for your hips and your knees to be at a 90-degree angle, or roughly 90-degree angle. So now, if you need to either raise the chair. Yeah, I know. I can't get to it. So for the next thing, you want to adjust your seat back. You want to maybe bring it up or down, and that will adjust the height of your lumbar support. So then you want to adjust the seat pan, which is where the back of the chair, like how far it is away from your back. So you want to bring it so that back enough so that your legs are supported by the entire seat, but you want there to be about 3 fingers of space between your knee and the back of the chair, and that's going to keep you from the chair from pinching on any nerves that might be back there causing issues with your legs. So then you have your computer setup. So you want to make sure that when you are sitting, you're looking directly at your computer. Some people I found, I don't know if it's the setup of their desk or whatever, but they will have the keyboard in front of them, but they'll have their monitor off to the side. And some people say, well, I just can't do anything else. And maybe you can't. There are some things that you just can't get around, but we try. So the idea is to have the desk, the computer in front of you, the keyboard in front of you. Now the keyboard should be in a position so that your elbows are about at 90 degrees. And I think I forgot the armrest portion of the chair. So you want to have the armrest just below your elbows so that it keeps them at 90 degrees. So then you have your keyboard in front. Some people have a tray that will allow them to do a little bit of adjusting. Other people don't have that option. So if you find that your keyboard is too high up on the desk, which happens especially with people like myself who are a little bit shorter, then you have to go back to your chair. And then you have to raise the height of the seat. So now your feet are going to be dangling. And that's terrible. That's like kiss of death, back pain. So you want to then get a footrest. Doesn't have to be anything fancy. I use like a little bolster that I found in my office, but you can use a couple books, a box, whatever. Just something that's going to keep you in that 90-degree angle. So again, with sitting, you want to make sure that you are getting up frequently. For desk work, I suggest every half hour if you can, which most people can, because they're not in a truck. But you are doing work, and I don't expect you to step away from your job, but even if you just stood up while you were on the phone, that would be better than nothing. Get up, stretch a little bit. You can do some of the exercises that I talked about before. They work for everything. And then you just sit back down and go back to your job. You just have to remember, and I find that the number one thing that people say is, well, I forgot, and it was 3 hours and I'm still sitting. So I suggest setting a timer on your computer, your phone. Sometimes like Fitbits will cue you to stand up if you haven't moved in a while. So if you use one of those, that's great. Another possibility is a standing desk, or a desk that you can sit but also stand. That gives you the versatility to move back and forth. They're a little bit expensive, but sometimes they're worth it in the long run. And then so we have our thing. All right. Any questions about desk stuff? All right. So now we have all these beautiful exercises that I got for you. Now, if you already have back pain, especially if it's bad or if it's traveling down your legs, you probably want to see a doctor before you start an exercise program, just to make sure everything is okay. But then they might suggest, oh yeah, do some exercises. Sometimes doctors will say, oh, look up some exercises online. Well, I've already saved you the job of looking up the exercises online. Or they'll say, go do some physical therapy. But, so these are general exercises that I think are very helpful. Now, I broke them up into a couple different parts. We have, the first page is specific lumbar stretching or low back stretching. The second page is stretching of the legs, which, you think, well, why am I stretching my legs? But a lot of your leg muscles attach at your pelvis, and they can, if they're tight, they can cause issues, and they can cause back pain too. So if you've got really tight hamstrings, which I bet a fair number of you in this room do. When you bend over, your hamstrings have to bend, as well as your lower back. If your hamstrings stop here, your back has to do all of that work to go down. So having a little more flexibility in the spine can be helpful. All right. And then the last page is lumbar stabilization exercises. So actually core strengthening exercises, things that you guys can do at home that require very, very little equipment, or actually no equipment to do, just to get a little bit of strength in the core. You hear people talking about core strength all the time and how important it is for back health, and it's true. It's very true that having good strength in your core is going to protect your spine when you're doing all of these activities that you have to do. All right, so anyone want to